Canada's Public Safety Minister and Canada's new Fentanyl Czar have wrapped up their mission to Washington. Over the last 2 days, they've met with both the U.S. Border Czar and the Secretary of Homeland Security to argue against those tariffs on March the 4th.
We've been able to show major progress. We've been able to highlight and showcase the investments we've made. We've shared that information in detail, and it really is now up to the administration to respond.
Canadian officials have said U.S. officials are pleased with the progress on fentanyl, but just yesterday, the one person who really matters said otherwise.
I don't see it at all. No, not on drugs. They're only apprehending 1%. You're right about that. It's a little more than that, but they should be apprehending much more because a lot comes through Canada. And as Mexico gets stronger in terms of the border, it goes up to Canada.
So what did Canadian officials hear in their meetings in Washington? Kevin Brosseau is Canada's Fentanyl Czar, and he joins me now live in the studio. Sir, it's good to see you. Thank you for being here.
Thank you for having me.
You heard what the president said there. Is that what you heard from Tom Homan, his border czar, in your meetings with him yesterday?
We had an opportunity, David, to be able to tell Mr. Homan, a bunch of other American officials about the efforts that we've taken, and they've been substantial, both with respect to the movement of people across the border, as well as with about fentanyl. So impressed around the efforts, including listings and various other elements associated there too. Where the ultimate conclusions go is where they will go, but we had receptive audiences, and I would say very interested and pleased with the efforts that Canada has taken.
Okay, so you met with Tom Homan. I think you also spoke with Homeland Security Secretary Kristi Noem as well. I spoke with Mark Miller about this yesterday, and he very candidly acknowledged that you can have all of these conversations you want. There's a constituency of one who really needs to be convinced. And Donald Trump was saying as recently as yesterday, there's still too much of it coming in and you're not doing enough. So does that align with what others are telling you in terms of their assessment of the reductions in seizures and the measures? Do they see a meaningful reduction?
Yeah, the focus of my conversations with counterparts, whether they be officials or elected representatives in the U.S., David, was to be able to ensure that everybody has the ground truth, and we're able to ground truth the efforts that we've taken, the steps we've taken, with the data that we have, which shows that, relatively speaking, Canada, the fentanyl crossing from Canada to the U.S., particularly as compared to Mexico, is minuscule. But we also agreed that we would work together, because ultimately what crosses the border is one thing, but we also know that fentanyl is a big problem in this country.
Sure.
21 people average die as a result per day, die as a result of fentanyl, and that's where I'm laser focused around integrating efforts between the federal departments, the provinces, and as well as with my American counterparts. It's a shared concern on both sides of the border.
No, look, it's an absolute crisis. It's a public health emergency, right? In every country where fentanyl is pervasive. Right. The economic threats against the country, though, are on those cross-border shipments.
Right.
The U.S. Border Agency says fentanyl seizures at the Canadian border last month were down 97% versus December. That seems like pretty convincing data.
It does.
Donald Trump doesn't sound convinced. So if the data doesn't convince the president, how do you do it?
Well, I don't know what is or what is not in front of the president. I remain laser focused, David, on ensuring that we're taking all efforts possible, whether it's at the border or domestically. I'm trying actually to be less concerned about that ultimate conclusion that are being reached by the president, and more concerned about being the integrator and the collaborator that I've been tasked in the mandate that I received for my job. Right. And I'll do that job and be focused on that.
It seems to me, though, Mr. Brosseau, that if it's 1% of the fentanyl seizures going in, and they've been reduced, at least for 1 month, by 97%, it's pretty hard to do a whole lot more, right? So when people say just secure the border, do more on this, I mean, what more can you do?
Well, it's a small amount. There's no doubt about it. But you know what? The efforts, to me, whether it's the 10,000 officers on the border, whether it's the air surveillance, whether it's the enhanced checking. Well, we heard this week, you saw probably that Project Blizzard by CBSA, their efforts in the mail and courier area, the RCMP responding about their blitz and what they found, major seizures across the country that no matter how small it is, and I've said it publicly, and I believe it, that it should be driving down to, we should be doing everything we can to drive that to zero. And that's aspirational, I get that. But I think if we all have that mindset, the efforts will continue. And we should. It's good for our country, it's good for Americans, and I think it's what Canadians expect.
Right. So look, the larger public discourse of the recent weeks has been about the border, but this is an enormous problem domestically, right? And the western provinces in Canada, in particular, have been hit incredibly hard with high per capita deaths in British Columbia, Alberta, and Saskatchewan. Right. Your role, people look at it mostly in the context of a response to Trump, but there is a domestic component to it. I mean, how do you help on this internal thing? I know we saw announcements today on tougher controls over precursors, the announced by Minister Sachs, and these sorts of things. What are the big priorities for you in dealing with fentanyl as a domestic challenge?
Yeah. So it's a supply and demand as well, David. We've been talking a lot in the context of the border around supply and how that works, and the efforts in terms of being able to quash that, whether that's listing of the cartels as terrorist organizations, et cetera. But it's also on the demand side and working with provinces, municipalities, advocate groups, and families. I've talked to families, and they've talked to me about how horrible the situation is that they've had to deal with their loved ones. And I take that to heart and I say, okay, tell me about what would have helped. What can I do? And I know provinces and cities across this country have different initiatives in place, whether it's on the prevention side or on the treatment side. I want to work with them, find out what's working, and actually amplify that in other places around the country.
So, supply and demand. Supply, I'm not saying it's easy, but it's more obvious to me, right? Precursors, law enforcement, seizures, money laundering. Demand's a whole other thing, right? Because there's getting people into treatment, but it's an illegal substance. People have severe addictions. What are the big steps you can take on the demand?
Well, look, I think to me, people have been, and people around this country have been dedicated for years. I was in Manitoba in mid-2010s, and we were talking about working on it at that point. So clearly it's not new. What I hope to be able to do is to be able to bring people together that perhaps haven't been working necessarily together in a meaningful way. And whether that's in between provinces and police and healthcare workers, et cetera, to actually take an integrated approach where that kind of ounce of prevention is worth a pound, right? And really hammering on those points and ultimately being able to make a difference. I'm hopeful. That's why, I'm taking this job. I'm quite optimistic that I can help. And even if it's that, connecting dots that perhaps haven't been connected in the past.
I don't mean to sound disrespectful when I ask this question, but I'm sure you've seen some of the criticism that this position was just a response to try to mollify the president, right? That they created this to satisfy Donald Trump. Do you feel you have the structure, the departmental support, the resources, and the authority behind you to do this? Because it needs to be more than something to make Donald Trump happy. It needs to deal with this problem internally.
Yeah, it does. I'm not here to make Donald Trump happy. I'm here to do something for Canadians. I'm a career public servant. I'm a cop for a number of years and worked in communities across this country. And that's frankly what gets me up in the morning and gets me going. And that work will continue. I got a clear mandate from the Prime Minister. I've had an amazing collaboration from ministers and deputy ministers and, in fact, premiers who have said, good, we're going to work with you to advance the work that we need to do in our particular jurisdiction. So everything I have not heard at all anybody's kind of writing me off and saying, well, you're just this guy or that guy. In fact, people are buoyed by the opportunity to have somebody who's singularly focused on an issue. And that's what I can bring to this position and this role, is that I'm responsible and I've got the tag to work on dealing with this scourge. And that's what I'm going to do.
Okay, so we call it Fentanyl Czar shorthand. What's the title on the business card? Is it Czar? Like, what is the actual full name of the job?
The Commissioner of Canada's Fight Against Fentanyl is the formal legal title, I guess. But the Prime Minister announced me as Canada's Fentanyl Czar, and I'm taking that, and I take that to heart. And by that means that I'm the point person. I can muster up colleagues to be able to advance in a particular way to drive an agenda and drive change. So I'm embracing it. How about that?
Well, Commissioner Kevin Brosseau, Canada's Fentanyl Czar, good luck, and we appreciate you taking the time to come in today. We appreciate it, sir.
Yeah. Thanks, Steve.